Hi everyone, I'm Daisy Shu, co-host of Behind Our Science, and you're listening to episode 30 of our podcast. This is the show where we bring you into the minds and labs of the scientists shaping our future. Today, I'm joined by Dr. Jingjing You to explore the cutting-edge world of corneal bioengineering and biomaterials. Let's dive in. Hi everyone, it's Daisy Shu here, and welcome back to Behind Our Science. I'm so excited for today's episode because I'm joined by someone I've known for quite a while, Dr. Jingjing You, who's now leading the multi-dimensional research group at the University of Sydney. Jingjing is a Horizon Fellow, which is a highly prestigious fellowship at the University of Sydney, and works in the Centre for Drug Discovery and Innovation. Her research sits at the cutting edge of science and technology, using 3D bioprinting, tissue engineering, and AI to tackle big challenges in regenerative medicine and eye health. From creating custom biomaterials like collagen bioinks to designing bioengineered corneas, her work is all about finding new ways to restore sight and heal tissues. Jingjing and I first met, this is way back in 2011, when I was a summer research scholar at the Safe Sight Institute and Jingjing was doing her PhD at the time. And many years later, our paths crossed again through a grant that she applied for from the University of Sydney, a global partnership grant with Harvard, back when I was a postdoc at Harvard. And this was really exciting because this allowed Jingjing to also visit me and do a lab visit at Harvard, and we got to hang out in Boston, which was really fun. And now we're both back in Australia, back in Sydney, and we're collaborating once more on some research and also on a thematic issue for the American Journal of Pathology, AJP. So we're guest editors for a issue titled Front to Back, Pathobiology Mechanisms and Innovations in Ocular Disease, which is going to be released sometime this year. And it'll be a comprehensive look at ocular pathobiology spanning all the tissues from the cornea to the retina, with a strong focus on disease mechanisms. And so today, without further ado, we'll be exploring Jingjing's groundbreaking work in corneal bioengineering and beyond, looking at her innovations in material science, manufacturing and machine learning, and how she's pushing the boundaries of what's possible in vision restoration. So let's dive in. So welcome to the podcast, Jingjing.
Hello, Daisy. That was a lot of good words for me. Thank you very much for the introduction.
Yeah, so talented, Jingjing. And I know a lot of our listeners are, early career researchers. So it's really inspiring to hear your journey. And can you share a bit about your academic journey and what sparked your interest in corneal tissue engineering?
So I did my PhD actually looking at biomarkers for prostate cancer, very different to cornea. But I was looking at biomarkers in human body fluids like human tears, blood. So I think that human tear connection after my PhD, got me into Safe Sight Institute, where I work with Professor Gerald Sutton. And at that time, it was to look at biomarkers for another corneal diseases called keratoconus. It took me a long time to actually learn what cornea is, because it's very different to cancer tumor structures. And then we were looking at biomarkers and through proteomics techniques, but I also know a lot of proteins. And we just start to kind of have discussions on what can we do more. And I asked Gerald a question, what can I actually help you in clinic beyond biomarker? And so he actually told me that there was this condition of non-healing corneal ulcer. And I say, well, maybe we should look into regenerative medicine to look at how can we actually help the cornea regenerate. So he asked me, what do I need? And I said, I need a conference ticket to a regenerative medicine conference in Europe, and which that was one of the big ones then. So I went there, heard a lot of good ideas, bring it back to Australia, and then we start to work on regenerative medicine and moving to biomaterials, moving to bioengineering, and probably about maybe about 8 years later. So now I have my research group called Biomedical Innovation Group, BIG. So it's a new name. So my team member just created this name, I think, a couple of months ago. So it's a new one. Yeah. And now our team, we have 10 staff, including students, and we're working on corneal bioengineering. We also expanded to retinal, neuron, and skins. I have like 3 postdocs who are very talented and working on different areas of tissue engineering. So that's a story. Yeah.
Wow, amazing. So inspiring. And you have quite a big lab now.
Yeah.
Big group.
I guess like from now I'm thinking like the first thing maybe is to have a good supervisor. So as an early career, to have a research leader who will support you and support your ideas and help you expand and help you grow.
And it's interesting to hear that you went from prostate cancer. Was it prostate cancer?
Yeah, it was.
All the way to the corneal like regenerative medicine.
Yeah.
And it's obviously a huge shift, but it's amazing how like quickly you learned in this new field of research.
Yeah, it was challenging. It actually, because it's very different to my PhD work. So sometimes when you apply for grants, it doesn't seem to be good because your publication has a big change. But then I guess the important thing is does your actually make like research impactful? That's what is important. And so I didn't regret to change the direction. I actually think it was really good that I moved into a new area. And now with the funding, we're actually moving back to keratoconus again with machine learning algorithms. So I feel that a lot of time the technology is just connected to each other. As long as you do need to spend time to learn a new disease and learn a new model, but then your science knowledge that you trained through PhD, the design of the project, experimental plan, the technology you can easily learn because you keep learning new technologies through your PhD. So all of these fundamental skill sets, they are transferable across different fields and different diseases. So it's not easy, but it's definitely doable. And if it's something you wanted to do, I say just go ahead and give it a try.
With the cornea, it is a great tissue to be utilizing for 3D bioprinting. What makes it ideal and what makes it a challenging tissue to work with?
It is a very interesting tissue because it's one of the transparent tissue in our body. So you can actually see its structure, and its structure is being well studied. So it's got this very organized 5-layer structures, and each layer, what cells, what matrix protein have all been researched and identified. So it's easy to actually start with. It's an ideal model to start with because the other tissues have really complicated blood vessel going through the nerve, like hair follicles and a lot of different structures. So it's actually really hard to make. But then the challenge is it's very easy, or it's relative compared to other tissue, to make the structure of cornea, but to actually make a functional cornea, that's the challenge. So you can make a shape and looks like a cornea, but then to have it actually behave like cornea, in particular, you be able to bend the light to the right angle, have the mechanical strength, that is challenging, but that's also fascinating for researchers.
Yeah, definitely so many challenges. And I know that the cornea is the most innovated tissue in the body.
So we did publish a review with our partner organization. Actually, maybe I should just put this on. So with the Bioengineer Corneal, part of this organization, the Australian National Consortium, called Bienco. Full name is Bioengineer Human Corneal, and we have 6 partners. University of Wollongong, us, University of Sydney, University of Melbourne, Sarah, Centre of Eye Research, Australia, and New South Wales Health. So Queensland University of Technology. So we work together to actually bioengineer the entire cornea. And so my colleague from University of Wollongong, Dr. Zhi Chen, we together published a review paper on innovation to cornea. So talking about the nerve. But it's not funny, but interesting thing is when we do currently in cornea transplantation, the nerve can grow into the human cornea. So we're hoping that if we are making our bioengineered cornea very, very similar, or exactly same as the human cornea, then nerve can penetrate and regrow into the bioengineered cornea, so we don't have to worry about incorporating nerve into the cornea.
It will grow back into it. That would be perfect.
Yeah.
And I know that your team works with custom biomaterials like collagen-based bioinks, and that's something we worked on together. How did you go about designing this material for biocompatibility and function?
Yeah, it's also very interesting because when we start looking at bioengineered cornea, and because we're looking at that time 3D printing is really popular, so we were like, oh, can we actually use collagen, which is made up 80% of the human cornea? Can we make it into a bioink? So we're printing the cornea, but at that time a lot of papers were saying that collagen are weak, and so you had to add additional stuff into it. And another time, and I think that was 2015, 16-ish. We don't want to incorporate foreign components into our bioink because human cornea does not have those foreign components. How can we increase the mechanical strength of collagen? Can we increase the amount of the concentration of collagen? So we actually tried a lot of buffer. So at that time, my PhD student, Charlie Son, he tried more than 50, I think, different buffer.
Wow, 50.
Yeah, to try to solubilize collagen, because normally if collagen is in neutral pH at room temperature, it precipitates. It's not soluble. But we tried more than 50 buffers. Eventually, we figure out a couple buffers that actually can dissolve a high concentration of collagen at 12 milligram per ml, even up to 24 milligram per ml, and the collagen still remains soluble and clear in the solution. So we patented. We patented the collagen. Use this buffer. We patented the collagen bioink type 1, and we patented type 4 collagen bioink. So they become the base of our 3D printing cornea.
Amazing. It's so cool that you can print out a cornea using your patented technology with the collagen 1 and 4. With I'm envisioning the process of doing that, and I think you've described it a bit, but can you share a bit more about it? Because I recall that you have a special pen or device where you can really precisely print out the cornea.
Yeah, so talking about pen, that's another interesting stuff. We do so much. We do so much with cornea. So the first thing we did with cornea was to try to treat non-healing corneal ulcer. And so at that time, we were using fibrin. So fibrinogen and thrombin and human pyrrolizate-based components to make a clear bio glue. And that bio glue was made before 2016. And then we collaborate with Wulonggong Group to have their engineer to make a pen. So we actually use, and we later on called it iFix pen and iFix ink, so the iFix system. And we patented as well, and that's licensed to a company called iFix Medical and startup company. So we, with the pen, so surgeons can actually pen the iFix ink over injured cornea, and it will cross-link because fibrinogen robin cross-link, and then it will just seal the surface and provide nutrition for the remaining cell to regenerate, and provide scaffolds for faster healing. So that's the iFix product, and that was the beginning of the 3D printing cornea, because that was the time when we realized, oh, we can print something on a supporting structure. Can we actually print the entire cornea? So yeah, so that's the pen. And then with the collagen, we were 3D printing cornea. Initially, we were using extrusion printing to print a cornea structure. Now we upgraded to, because our collagens are light activated bioink. So now we use DLP, so digital light printing, to
3D printing.
Yeah,
Wow,
let me
that's
check
so cool.
DLP. I think DLP.
Yeah, no, it's amazing how you've advanced from the pen to now digital light printing.
Yeah, let me check.
It's so cool that you even had a startup that came out of your work, which is incredible. The iFix Medicals you were mentioning.
I have, so if we're looking at the time, so iFix was 2018, supported by New South Wales Medical Device Fund, and we are still running it and doing trials with the iFix system. And then it's the 3D printing, it's the Bioengineer human cornea, which is BNCO, and it's a holy grail of bioengineering entire cornea. It's challenging, but it's also really exciting. This is also going to be a company, and then after that, later on, after visiting Harvard, before visiting Harvard, we were having a collaboration with Fudan University, and then I'm going to Harvard and come back. We're working on retinal bio group, and then so I had a third startup company that were founded last year and called Retina Repair International. Yeah.
Wow, congratulations. That's huge. It's amazing. It's so inspiring to hear about the startups that are coming out of your work. With the iFix system, is that biodegradable when the corneal wound heals? The glue will degrade?
Yeah.
Is that correct?
Yeah. So it is biodegradable. Yeah.
Okay.
So and it's mainly for the superficial wound. So if it's a really deep and big wound, we do need 3D printing cornea. Or we need bioengineered cornea.
Big, you can't just fix it with a pen. And what are some current clinical applications or trials that are underway that use your corneal bioengineering work, or that you're moving toward?
So the iFix pen is actually, because it's a full running company, so I wouldn't talk too much about it without the CEO of the company giving
an NDA.
But with other work, so with BNCO, there's also a lot going on, but we haven't gone to the human trial yet. With the retina bio group, we're actually planning human trials. So in short, none of the product has been human trial yet, but they are pretty close to human trial.
That's exciting. That's so cool that that's on its way.
Fingers crossed.
Yeah, fingers crossed. Can you walk us through how your lab translates material science into regenerative therapies? What's your process?
That's actually a question. Can I just ask? So you mean like how to translate material science? Okay, yeah, cool. So basically, what the materials that we're working on are biomaterials and mainly protein based. So collagen supporting, actual cellular matrix proteins are proteins. So I don't work with synthetic materials. I only work on protein-based materials, and that's also because my PhD was proteomics. So I know proteins a lot more than other molecules or other materials. And so when we are using proteins to turn it into printable materials like bioinks, like collagen bioinks, or modified proteins, like JAMA, so it has those cross-linking site for the light to help it cross-link. We turn proteins into scaffolds, and major gel is another materials. And so once it becomes a scaffold, and it become quite useful for repairing, because a lot of times cells are slow in repair because they have to secrete their own matrix to kind of make scaffolds so that they can regenerate. But we just providing external materials to that the cells like, so that mimicking the cell's natural environment, and therefore cells will be, with what we see, cells is become quicker in populating the area that we already fill in with the scaffold compared to the rate that they populating area that was nothing. So providing this actual support that's mimicking the environment is helping regeneration.
A natural environment, that's really great. How are you incorporating machine learning into your lab's work, whether in designing materials or monitoring tissue growth or predicting outcomes?
Machine learning has been actually used quite a lot already for tissue culture, and so like ImageJ has got a lot of built-in functions that actually machine learning based to recognize cell morphology. So we pretty much just use those already developed tools to monitoring cell growth and looking at cell morphology. But what we did, or developing machine learning model is in fact back to the keratoconus disease. So when I never forget, that was the first project I was given, finding biomarkers for keratoconus, and which I can't find biomarkers for that. But I have been always thinking, how can I then help out monitoring keratoconus progress? And so I always thought that one biomarkers cannot do the job. It has to be multiple ones. And then, with the rise of machine learning, so I think it had to be machine learning to actually try to recognize the pattern. And so I initiated work with a mathematician professor at UNSW, so your university school of mathematical, and then we recruited a PhD student, Dr. Nicole Ham, because she has already completed her PhD and she's now working in UTS, continuing developing and using machine learning technique for other diseases. So what we did is then we're collecting thousands of data, and then we trained with a a simple neural network model, and then try to train the model to classify different stages of keratoconus patients' progress. And with the initial data, we reached about 85% accuracy, and we published one paper. But now, to further progress this, we need more data, and it's actually quite challenging to get lots of data for keratoconus because in Australia there's not many. So we're looking into working with international partners, but we're still at the stage continuing recruiting data.
Recruitment of patient samples is always such a challenge. You've built impressive collaborations with institutes such as Harvard with me back in the day, and also you mentioned about Fudan, and from reading your bio, you've also got collaborations with the University of Auckland and other institutions around the world. What has been the most fruitful partnerships that you've developed over the years, and what advice do you give for people looking for collaborations?
So with Fudan was probably the most successful one, but that's also because it was the earliest international collaboration. So it was in 2019, and one of the colleagues from Fudan came to Safe as a visiting fellow. So I start to know the person over 2 years of her fellowship. And then when she went back, we applied for funding together. I'll get funding, so we start to developing the retinal glue, and then later on patent it, and leading to the spin-out company. And so time and commitment is really important for international collaborations. And then with Harvard is really good. We haven't yet had anything like patent or anything, but it actually told me how to apply for US grant. So that's a good thing. But now, it's harder to get US grant. But we signed material transfer agreements. So I'm yet sending more materials for, your colleagues in Harvard to try.
And how do you navigate the challenge of translating your lab's discoveries into real-world therapies?
Well, it is really, really hard because it's a very different path. Almost every skills you learn for research become slightly less important in the translational path, and then other skill set become more important. So, such as you have to have your clinician, and customer support. So really had to, I think that's the first challenge, is your product really being recognized by people who have the need of using it. Because sometimes you have this technology and then you present to the clinician, they're like, oh, no, there's a cheaper one and I don't really need yours. And then, and so that's the first hurdle. And to solve that, it's good to have clinician at the beginning of collaboration, so you're actually targeting a real world problem. And then it's to having another team. You have your research collaborations, you have research team, you have PhD students, you have a lot of research support. But when it comes to translational, you need a new team. You need people who can help out GMP production, understand regulatory process, have connections to investment funding, can do market analysis, can actually really talk to investors, talk to a lot of people, like salesperson. But when I say like salesperson, I really realized how difficult it is to be a salesperson, a good salesperson. So salute to the sales. It's, you think this word is so common, but it's really hard to be a good one. And then, of course, people who can do clinical trials, can help all the, quality checking, all the documentation. So it's entirely a different team. And I think it's important to really kind of know your strengths and your limitations. If you really wanted to be the CEO of the company or really focus on translation, or you will have to start to learn all these skills. Otherwise, you could be in between. So you still hold your strong research skills. You learn a bit about the other side, and then you become a scientific advisor or technical kind of support, or not support, you can, because you developed it. So you kind of advise and help technical challenging, and help integrate into scaling up GMP production, and that way you can do both. But if you wanted to really push the company forward, you need a totally different set of skills. So I think it's decision making as well.
Wow, it's so complex, and it looks like you probably need some additional qualifications and training to be a CEO. Perhaps an MBA might be something to consider to be a CEO.
Yeah, the good thing is New South Wales, at least in Australia, New South Wales government has a lot of medical device commercialization training, translational training. And so if you have patents and then apply for some translational fund, you get connected to those network, And then like Cicata in New South Wales, they provide commercialization for medical researchers training. So it's like half a year course, and you be there 2 days, then you really understand the whole process. I think that's really good certificate. Like,
good to know. Good to know for our listeners who are, interested in expanding their work to a startup phase. So that would be great.
Yeah. The first
you
thing
and
sorry, go ahead.
Yeah, no, go ahead. Yeah, I was gonna...
I said the first thing maybe is definitely need to have a patent, and then you can talk to your local university tech transfer officer. And then so if you're in New South Wales, search Cicata. I think if you're in Victoria, so Melbourne, search MedTech Connect. I don't know, other states, maybe Queensland also have their innovation hub. So almost every state, they have a hub to help startups.
Now, since a lot of our listeners are students and early career researchers, and some of them may be interested in entering the field of bioengineering and regenerative medicine, what advice do you give to these students? What would you like to tell them?
I say to find a really good research team that have access to emerging technologies. So the field of regenerative medicine, and so in particular the bioengineering field, has been rapidly changed with the new 3D printer. Almost every year you see the new 3D printer coming out, the new technologies that are coming up. So it'll be really good that if you find a research group that have access to those new technologies, because you can build a lot of biomaterials, but you need those really good fabrication technologies to actually turn the materials into the shapes that you want, with the high resolutions, with a lot of different functions. So definitely I'll say, look out for look for the research team that has access to technologies, and also if you could look for the research team that actually have multidisciplinary researchers in it, because this bioengineering requires a lot of expertise from different fields.
Looking ahead, what breakthroughs in corneal bioengineering are you most excited about over the next decade?
I would say that I think in the next decade you will see bioengineered cornea in patients. We're gonna have bioengineered cornea to let's say not to replace the donor cornea, but certainly it will reduce the burden of using donor cornea, and there will be no there will be no tissue shortage, and there will be no waiting list for cornea transplantation.
Immediate transplants.
Yes.
Cool. Well, thank you so much, Jingjing, for coming on our podcast and sharing all your insights and all your great advice, and sharing your academic journey and all about corneal bioengineering and beyond.
Thank you very much, Daisy.
Thank you. And to our listeners, stay curious, and we'll see you for our next episode of Behind Our Science. Thanks. Bye. Thanks for joining me on episode 30 of Behind Our Science. We've got more fascinating stories coming your way, so stay tuned. And as always, stay curious.